You're listening to the Lean Six Sigma for Good podcast. We help you learn how Lean and Six Sigma concepts can be applied to nonprofits, NGOs, and not-for-profit organizations. Visit us at leansixsigmaforgood.com.
Welcome, everyone. So today on the podcast, I've got a special guest, Shenae Samuels. She has a master's in public health and she's a PhD. And we met at a social impact event here in Fort Lauderdale area. The Chamber of Commerce put on an event that I presented at and talked about lean and nonprofit work. And you and your husband came and talked to me afterwards. So it was great meeting you. And we just went through a volunteer event, and I thought this would be a great opportunity to have you come on the podcast and share with everyone all the stuff you've been working on and all your experience. So welcome.
Thank you so much for having me, Brian. It's a pleasure to be here today, and so glad that we're connected and we're continuing to collaborate. As Brian said, I'm Dr. Shenae Samuels, and I'm the founder and principal consultant of Map Data Studio. And we work with nonprofits or mission-driven teams to help them make better data-driven decisions, as well as to help them define, measure, and communicate their community impact.
That's great. Talk to me a little bit about how you got into the space. So what were you interested in school and what did you study? And yeah, just walk us through some of your early education.
Yeah, sure. So my background is actually in health services research, and I would say that my love for working with nonprofits really started back at the University of Florida, where I did all my degrees, forever a Gator. So I did my undergrad in health education and behavior, and that's really where the story began. Doing a health education and behavior program means that you're working a lot with grassroots organizations. The groups are doing on the ground work of expanding healthcare access, preventing chronic disease, and basically advancing health equity. So I always had a love for that. And that's what led me to get my master in public health. And then eventually I went on to get my PhD in health services research. And the goal really was to use research to advance health equity, as well as to essentially ensure that all communities can have a healthier life, a longer lifespan. And I spent much of my, I would say, career working in very academically focused research. So I was a research scientist for 7+ years. I worked with Memorial Healthcare System and then eventually went on to work with Duke University, focused on cancer health disparities. And then I also have an academic background. So I worked at Texas Tech University Health Sciences Center as an assistant professor. 2 days after I graduated, I moved to Lubbock, Texas, and started that position. So I've spent a lot of time doing data analysis as a research scientist, as a professor within institutions, but I often felt like the work was important and I enjoyed it, but I felt far removed from my original, what sparked me to get into public health, right? Which is working with nonprofits, grassroots organizations. So yeah, I was reflecting on my why, like why did I get into public health? And I realized that I was far removed and I realized that I had the skills that nonprofits actually need, right? The skills that they need to do impact measurement, to do program evaluation, but they often don't have someone on staff. So that's what landed me into developing Map Data Studio. And yeah, it's been a transition, of course, from leaving your research career and diving into entrepreneurship, but I know that my data expertise is truly what organizations need, especially when it comes to measuring their impact, evaluating their programs, as well as getting more funding, because it's very much tied to your ability to have evaluation structures in place and being able to evaluate your program. So yeah, so that's what led me to develop Map Data Studio.
Yeah, and I do want to get into the impact work that you're doing and have you explain that. But was there something in particular that drew you into the health? Is there a problem that you noticed or what was the issue that really got you to realize there's this disparity going on? Or do you remember anything specific, or is just through research that you came across some of these issues?
Oh, I remember specifically. It's
Okay.
both, it's very personal to me, and I don't mind sharing. So I think from a very young age, I was very cognizant of the fact that access to healthcare was so important, right? So I'm originally from Jamaica. My parents, from a very young age, had health issues that they were facing. And in particular, my dad had leukemia. And when he got diagnosed, the treatment was very expensive. And combined with quality of care issues, Jamaica does the best with the resources that they have, and they often do a phenomenal job. But the reality is that they don't have the resources that we have in places like the US and Canada. So fortunately for my dad, he had an option of, he's a Canadian citizen as well, so he was able to go to Canada and get his treatment there. He actually enrolled in a clinical trial, and I think that's what sparked my interest in research. Because I was like, oh, there's patients who have another option outside of traditional, standard of care. Of course, at the time I was like 7. This is me looking back and realizing. So yeah, so I'd say that in combination with my mom, she has 2 autoimmune conditions from a very young age. Access for her was also very important. And then I had an aunt who had fallen ill and unfortunately couldn't get the care that she needed and ended up passing away at a pretty young age. So I believe all of that combined, and then doing my health education and behavior degree, I was like, this is where I feel like I would want to be, because I want to see communities and families live healthier lives and have proper access to care. So it started at a really young age, and I think right around high school, when I reflected back on my personal experiences or experiences with my family members, I was like, healthcare is where I want to be, because I want to make sure that families have adequate access to care and they're able to get better, and there's a less likelihood of premature death. It has been challenging, of course. I will not ignore that, but I think it definitely was what was needed to direct me to my purpose.
That's very cool. Let's see here. I don't know if you want to go more into the jobs, but I think maybe go into the impact reporting and management. Want to
Okay.
do that next, or do you want to cover anything more on the jobs side of it, the work you
I
did?
forgot that you're gonna edit this.
Informal.
Gosh, yeah. I
Also
think
needed a
the
drink for my
jobs,
coffee.
oh yeah, true, because I cannot function. I think we can touch a little bit more on the jobs. I feel like
Maybe
there's,
like maybe some of the work that led you that maybe now yeah, I guess I'll just open it up and you can decide how much detail to go into there.
okay.
Okay. So after school, you end up in Lubbock, Texas. Can you talk a little bit more about some of the work you did before you got into the consulting space?
Yeah, sure. So yeah, 2 days after graduation, I found myself in Lubbock, Texas. So I was actually in their healthcare management department, and I was also a program director. So newly minted PhD, and I was not only an assistant professor, but then I also had an administrative role, which was actually really good experience. I enjoyed it. That department was not heavily focused on research at the time, but we did do a couple research focused on healthcare management, of course, and a little mixture of public health as well. I eventually decided to leave that department for several reasons. I wanted to be closer to family. So I came back to South Florida and I moved on to Memorial Healthcare System, and I was there for at least 6 years, if not more, because I'm thinking, yeah, at least 6 years. Let's say at least 6 years. And within that capacity, I worked a lot with various clinicians. That was actually a great job in the sense where I got to use my data analytics skills every day and with various projects. We're talking about oncology work, pediatric surgery, primary care, of course, a little bit of public health. A lot of it was patient outcomes focused, which I think aligns well with impact measurement, right? We're looking at outcomes, but more so on a community level versus like a patient population. But that was a job that I honestly enjoyed. I love digging into data. That's probably the curious side of me. I've always been curious, even growing up. Like my parents said, I asked 10 million questions. And that definitely shined. That was something that you could tell within my research scientist career. I always had questions. I love digging into data, as I said. But yeah, that was a very enjoyable job. I eventually left and went to Duke University, where I got to focus more on the cancer side of research because that is something that's near and dear to me, obviously, given my dad's diagnosis. So yeah, so I got to work on cancer disparities research, which was also great. But yeah, over the years, 7+ years of being a research scientist, I have just developed incredible analytical skills. And again, it's just this feeling that I have I have over 50 peer-reviewed publications based on my years as a research scientist and collaborating with colleagues. And it's all valuable research. And I want to emphasize that because I really did enjoy everything. And I think that the research I did was valuable and it helped to move medicine forward in its own capacity, but I still just felt removed from working with grassroots organization. I did some work with the Florida Health Justice Project here in South Florida. And I think that kind of reignited the thought of maybe I want to go back and work with nonprofits and help them. My time with Florida Health Justice Project was focused a lot on COVID disparities. We know that healthcare disparities is a long-standing issue, but the silver lining, if you want to call that, with COVID was that it was brought to the forefront and there were more initiatives to narrow that gap. And I helped the Florida Health Justice Project with developing a dashboard that would highlight the disparities that we were seeing throughout Florida in relation to COVID-19. I did work with that, and honestly, that reignited my love for working with nonprofits. So after years of working within institutions, I was like, let's use my analytical skills that I've definitely sharpened by working in various capacities. And I decided to bring that skills into impact measurement for nonprofits. And I say impact measurement, but truly it goes beyond that. It's also using data to drive decisions, right? So yeah.
That's how we connected and hit it
Yes.
off because yeah, the
Similarities.
focus on
Yeah.
data and
Yeah.
statistics and yeah. So I'll have you walk through impact measurement in that work, but was that something you had to learn separate, or was that just something you've gotten involved with? I know a couple other colleagues that do this kind of work too, and I didn't know if that's a separate program people go through, like a Six Sigma program, or is it just that the space is looking to see how do I help these organizations report better on what they're doing? And yeah, what's the structure around this kind of
Right.
program? And then how do you get more into that, if that's a separate thing, or is it just part of the work you've already done and it's just gravitating to this?
Yeah, so it's definitely a part of the work that I've already done. Actually, during my time as a research scientist, I have helped with proposals, for instance, where I help them to develop their evaluation plan and looking at the metrics that would align with their objectives and their aim and what the funder would ideally want. So it's work that I've done. It's not work that I got to do a lot of during my role as a research scientist, but it was work that I thoroughly enjoyed. Hence the shift back to impact measurement. And then also during my PhD, we did a lot of work surrounding program evaluation as well. We touched on it a little bit during my bachelor's, but I really got into some of that aspect during my PhD. So it's work that I've already done and it's very transferable. Like actually the map framework. So the reason why the company is called Map Data Studio is because it's based on a map framework that I developed. And essentially the map framework stands for mission action proof, right? And the reason I developed that map framework is because with research, so when you're doing the scientific process, generally you start with a research question, right? And all your data points that you collect is anchored or tied back to that research question. So within MAP, mission is basically equivalent to your research question, right? So it should answer what you're trying to change, for what population. And that means that when you have your mission, your action now, which is equivalent to a data collection protocol in research, would guide the types of data or metrics that you collect to ensure that data is aligned with your mission. And again, that we're looking at outcomes and not like outputs only, right? Outputs are still important, but also to ensure that you're looking at outcomes. So you're looking at what actually changed for a population. So for instance, if you're working with a community and you're working with, let's say you're working with patients with type 2 diabetes, you may have outputs that are like, we held workshops and we engage them in healthy lifestyle cooking classes. That's great, but also we need to look at the outcomes. So like, do they have controlled A1C levels if you're providing lab testing as a part of your program? So yeah, so action is focused on ensuring that the data that you're collecting is actually aligned with your mission. So similar to what you would do in a scientific process. And then proof is, of course, your findings and your impact and communicating your impact, which I guess you can say is similar to publishing in research, right? So the MAP framework is borrowed from the scientific process because program evaluation is very closely aligned.
That's great because I run across that as well. People will say, we organized this workspace. We put in standardized documentation. We did all these actions, and that's great. And those are all good principles. And we put up better signage and labels, and people are enjoying this, and they say it's better. But at the end of the day, it's like, how do we prove that? We can do some surveys and stuff like that, but where's the real impact to the organization? Are you getting more things done? Are you able to accomplish more? Is the output better? How do we put some numbers to it? Because that's a little bit more objective, and using statistical thinking and principles to say, is that real differences or is it noise? How do we separate that out? So yeah, I think there's a lot of focus on getting actions done, but ultimately to make it real, we have to see the results.
Correct. Yeah. And I think even just framing proof around percentage of whatever your outcome is. So going back to the mission, if you're working with a population or a community of individuals who have type 2 diabetes, let's say your outcome is to improve A1C. So you ultimately want your population to have controlled A1C levels. So using that always to anchor your outcome and saying what percentage of the people that I am serving or who are in my program actually have controlled A1C. But also, I think what's important too, which I think a lot of nonprofits sometimes miss the mark on, is looking at timeframes, right? So not only just looking at one time, but having a baseline, of course, to compare to. But then after 30 days in my program, what does that look like? Is that percentage going up or is it going down? If it's going up, then yay, we're improving lives, right? After 60 days, what does that look like? After 90? It's very much similar to research. I think the difference here, or what I believe is the difference, is that with research, obviously the goal is to publish, to move evidence forward. And you can do the same with your community programs, of course, because that does help other individuals or organizations who are developing similar programs. But the focus truly is on ensuring that the programs that you have in place are actually making a difference. And like you said, having a quantifiable measure versus testimonials, which is great. Testimonials are always great, but I think when you pair testimonials with something that's quantifiable and you're able to say, one person that I spoke with in my program said that their A1C is now controlled and they're healthier, they feel great. But then when you pair that with, not only did that person experience controlled A1C from our program, but now 75% of our participants have had controlled A1C, and that's up from, I don't know, let's say 40 something percent within 90 days. So I think the two should be should be provided because I think testimonials are great as well. It gives a why behind the statistics or a bit of a human touch as well. But I think oftentimes because nonprofits are focused on delivering programs, saving lives, it's easier to just grab some testimonials versus digging into the data and making sure that they're actually measuring outcomes.
Yeah, and getting the baseline and gathering all that information and establishing a current state of how things are going and where they're at, that's a lot of work. And that's why when I go through training and teach people, we spend a lot of time on that because this is what you're going to compare when you're done. And if you're not real concise and clear about where you're at, it's going to be hard for us to go back later and compare and show that there's an improvement or difference there. And it's a struggle even for organizations that I would think are much more mature than a lot of the nonprofits in terms of data collection and monitoring and tracking. It's still a challenge for them who that should be something they've been doing for decades. And so it's not new and it's tough. So it's not surprising that is a challenge for a lot of these organizations that doesn't have that same emphasis and rigidity of data collection and tracking and reporting, and a lot of opportunity there.
There was something I was going to touch on as well. Sorry, I keep forgetting that we can edit, so I'm like, out loud.
No, that's perfect.
Let me see. Yeah, no, I think I may have touched on
And you're
it.
doing great, by the way. This is
Thank you.
excellent job.
Thank you. I tend to get nervous and then I lose my train of thought. And
That's
then,
normal.
yeah.
I do too.
Yeah, okay.
I'm like, I gotta stop talking. I gotta get off this. I gotta make my point and move on.
Because I think everyone's attention span nowadays is very shortened. So you're like, ooh, let me hurry up. But it's like also
So much to share.
there was something I seriously was going to touch on though, and I cannot remember.
I had something I'm gonna add. I'll add real quick.
Okay.
That discussion around healthcare and data and test results and stuff, the A1C you were talking about, that reminded me of a project I got involved with. We were looking at Coumadin Clinic, and this is 20 some years ago. And the opportunities that we saw in this project to improve the care for patients taking these anticoagulation medication, we looked at the test results and we looked at lab differences, and we found that the different labs had different test results, which then affects the medication, which then changes their risk of being too high or too low, which puts them at different types of risks for adverse events or complications. And it's just like, even an organization that has a lot of structure and there's a lot of things in place to control the quality of the data and make sure the decisions are good. You go in there with a different perspective and different statistical mindset, and you're seeing these opportunities there, and it's just, that's an issue and that's a risk and that's a problem. And it was a little shocking, I guess, but also realize like how much opportunity there is in the healthcare space to bring in more data into decision making and historical looking at the patient results. Yes, that data point is off in isolation, but when you look at history of the last couple of months, that's not unusual data point for that patient. And each patient has a different profile and average and standard deviation. And so just bringing some of that into that space, that was my first experience looking in healthcare. And it was pretty eye-opening that there's a lot of opportunity there. And I don't know if it's really gotten that much better in terms of statistical tools and analysis in a patient setting and clinic settings. So I think there's a lot of room for improvement.
Yeah, I think so. From my experience working in a large healthcare system, a lot of physicians, I will say that especially the newer age physicians, they are being trained to be researchers as well. But the reality is, people tend to hate statistics. So I feel like it definitely, like your experience, for instance, definitely shows the importance of collaboration. For instance, like when I was working with my physicians, like I'm the data expert, right? So they rely on me to guide the study, develop the statistical analysis plan, which is very similar to an evaluation plan, maybe at times a bit more complicated depending on the type of study that you're doing. But it really points to the importance of collaboration and having someone who has an expertise in data, right? Because we all have our areas of expertise. Like, for instance, with my physicians, they're clinicians, right? So they kind of they literally guide, in a sense, the analysis plan as well, because they're able to point to guide decisions like what patients should be excluded based on clinical factors or things like that. So it really takes a team effort. And it's similar with nonprofits where their expertise is developing programs, right? And serving the communities, but their expertise is not in data analysis. And that's where people like you and I were able to come in and really help them to come up with solid analysis plans, or in this case, evaluation plans. But yeah, I will say that the newer physicians, they are more involved in research, which has been nice to see. I worked with a lot of residents during my time at the healthcare system, and they're eager to do studies. They're involved in research. Some of them have even come in with publications already. But the data analysis piece is usually where you'll find a few who actually know how to do data analysis. But again, it's probably not at the level or comfort level that we have, right? So I think that definitely points to the importance of collaboration.
Yeah, and when I teach classes and I ask people, have they ever had a statistics class? And I don't have a lot of hard data on this, but I would say 75 to 85% of them say, I hated that class. And my goal is I'm going to hopefully convert you over at the end of this training so that you say, I do like this stuff. I like it a lot more than I did in school. So it's a little bit of a challenge to me to try and win them over and say, okay, let's use some of these in practical applications so that you see how it benefits and how it can be used. And let me explain it to you in a way that I think is maybe a different approach you got in school, because it tends to be very technical and challenging way of doing it. So how do you introduce people in those concepts in a more practical way so that it is something that they say, oh, I understand this now. I see what we're trying to do. And I think it's a lot of it is once they're into a work setting and then they can understand the data that they're used to seeing and wondering about some questions, and then there's tools aligned up to it. I think it's really that practicality that you don't have in school, like in college, if you're taking a class like that. And once you're in the workforce and out there and doing real work, I think now they see the data and they start to connect the dots there. So I don't think it's necessarily something wrong with the way it's taught. I have some ideas, but I think it's the practical applications that they start to see now. Now there's an interest that increases there, but still try to make it easy to understand. I don't want people to be scared off by it or feel like it's overwhelming, but my goal is to try to get people to say, I actually like this now. I understand how it's applicable. So it's a challenge, but usually I'm pretty successful with that.
Yeah, no, I would definitely agree, because when I had my first statistics course, I was like, oh my gosh. If you told me then that I would be in this career, I'd be like, oh, you're hilarious, because I hated it. And it was once I started doing my master's and I took another course. And similar to what you're saying, I had the opportunity to apply statistics to research studies that I was collaborating on with professors. I was like, oh, it's actually not bad. And I feel like there's a sense of creativity behind statistics. You come up with a study plan, you have a research question, you see all the variables, and you're like, okay, so what test would I apply to this? What would the study look like? What would my research question be? What's my outcome measure? And what are my covariates? And things like that, where it's just, I think once you have the opportunity to apply it and apply it to something you actually genuinely care about, I think that's the important piece, right? You then get excited because you're like, oh, I do my coding and I run my analyses, I look at the results, and I'm finally getting something I care about answered through data. I think once you've had that experience a couple times, it takes a couple times, because trust me, I remember I used SAS for my PhD dissertation because it's really good with handling large data. And I almost had a few moments where I was like, okay, maybe I don't like statistics. But then once I changed over to Stata, which is my preference, and that's the other thing, right? You don't have to stick to one statistical analysis software, right? And I think that's the thing is that there's so many options now, and I just can only imagine with AI the possibilities. But there's so many options that even if you're not necessarily you don't enjoy a certain statistical analysis software, you can say, okay, let me try SPSS, let me try Stata. So I think you're right, or not, I think you're definitely right in terms of, I think once you've had the opportunity to apply it to something you actually care about and you're in a work setting. I will say, even for me, when I had my first research scientist job, I learned a lot more, right? I had already learned I had learned to apply my data analysis courses and I was on some research projects. But once I got into my first research scientist job where I was leading analyses for providers from various medical specialties, that's where I truly learned, or maybe sharpen, maybe that's the right word to say, sharpen my data analysis skills because I had the opportunity to answer various research questions, right? That meant I needed to apply various types of statistical analyses. So once you have the opportunity to get on the job, it's almost like additional training in a sense.
Let me pause for a moment to tell you about our sponsor. Creative Safety Supply is a great resource for free guides, infographics, and continuous improvement tools. I recommend starting with their 5S guide. It includes breakdowns of the 5 pillars, ways to begin implementing 5S, and even organization tips and color charts. From red tags to floor markings, it's all there. Download it for free at creativesafetysupply.com/5S.
Yeah, I even think back to my schooling, and I liked statistics and math and data, and so I went down that pathway. And the first class I took was brutal. It was like proving theorems and stuff, and I was like, "Is this what this course is like? I'm going into that? This is boring, and I'm confused and lost." And so, yeah, if people had a bad experience with it, like that, it may have just been the content and the way it was taught and the what details is going into, but then I was later a teaching assistant, and it was a stats for general studies. I don't remember who had to take that course, but it was for non people. It was for people who were not going to be statisticians, but they needed to have some understanding of these principles. And I was going through that and teaching this. I'm like, this is a really great course because it's teaching really practical uses of data and analysis. And so it's not theoretical and it's not proving out theorems and why this works. And that could have taken me out of that whole curriculum with that first course, like you said, and getting overwhelmed. And this is not what I got into. But when I saw that and then I get into the workspace and you're like, oh, okay, now this is really interesting. But if people have had a bad experience with statistics or data before, maybe they just need to try another approach, get into a greenbelt class or something like that to refresh them. I think they might enjoy it, especially if they have some work experience now to reflect on.
Or even hop on a research project and ask if you can shadow the lead analyst or something of that nature where you actually see it applied. Because I think once you see it applied, it definitely, not for all, there's always going to be a subset of the population who's just, listen, I don't want to do it. And that's why Map Data Studio's here.
That's right. Just
I think once you've had the chance to apply it and you realize that you can truly get valuable information from data, you will get to the point where you're like, oh, wow, I actually do enjoy digging through data and having various research questions, right? You should always have a primary research question, but you can also have other projects. Sometimes you do a study and then, or evaluation as an example, and you maybe get results that you weren't expecting, right? And that may lead to other questions. And that's kind of the beauty, especially if you have a curious mind of research, evaluation, working with data, because we tend to go in sometimes with expectations and then the data says otherwise. And we're like, oh, wow, wasn't expecting that. Obviously, you double check, you make sure that your analysis is correct and you were looking at the correct data and the data is correct. But sometimes truly it can uncover things that you didn't expect as well and lead you to or guide you to a different path that would make things more efficient or improve outcomes in the case of evaluating a program. So, yeah.
Okay, let's see. That's goals, nonprofit leaders. So we talked about, I want to talk through either I don't know if you want to walk through groups, like how you would help an organization or have helped organizations. I know you walked through the MAP process, but do you have anything like that you want to walk through? Or we also talked about some challenges in the nonprofit sector. I think we did touch on fear of statistics, gathering data, maybe the gathering data in the marginalized communities. We can touch on that if we haven't already. I don't think we really got into that detail. I think we touched on data-driven decisions. So yeah, I don't know on the like ideal clients part of it, how you want to
Yeah,
go
I
through
think
that.
we should definitely touch on that,
Okay.
the ideal clients, and then maybe just the services that I
Okay.
offer. Yeah.
Okay.
Yeah, I
And
have
we
to
can, okay.
hopefully
No.
some. Okay. All right.
Yeah, okay, I'll try to kick it off here. So if an organization is looking for some assistance or help, how do you help them or work through that whole map process with them? Maybe you can share an example or the type of clients you think would be really helpful or need it, or the type of clients that you think you can best assist or help.
Yeah, Map Data Studio is really focused on helping small to medium-sized mission-driven teams or nonprofits. So, like what we talked about before, these are the nonprofits that often don't have a data person on staff, and they don't need to, right? They can collaborate with, for instance, Map Data Studio, and we can help them with their evaluation plans. So that may look like clients who are applying or renewing their grants who may need help with developing their data evaluation plan. We talked a little bit about that. I've done that in similar capacities within institutions. We're also able to help clients who already have data and who may just need help with analyzing their data for impact reporting. Some of that obviously may involve ensuring that the data that they're collecting is actually tied back to their mission, ensuring that the outcomes that you're looking at are appropriate for based on the mission that you have, your mission's promise, we can call it. And then also we help with building data collection tools. That could include surveys, that could include if you're more comfortable with using Excel, that could be ensuring that we help you with your Excel sheet to ensure that there's consistency in the data collection. So data strategy as well, like who's responsible for inputting data, who's responsible for capturing your data points essentially. So we can also help with data strategy as well. But the goal is to make data analysis accessible to small to medium sized nonprofits. There was something else I wanted to touch on. Hold on. Oh my gosh. I wanted to touch on the mission, and I just realized when I said that. Anyway, let me go to,
You want
okay, yeah.
to go back? I can rearrange sections too, so move things ahead or behind.
Yeah, so okay. I'll just touch on the services as well. So yeah, so some of our services includes impact metrics and measurements, so program evaluation, survey design and data collection, data strategy, as well as developing data systems, and also, of course, impact analysis and reporting. And the goal really is to ensure that by partnering with mission-driven organizations that they're able to get access to a PhD level data analysis or data expert so that they can focus on their community programs.
And when you're helping them, you're looking at the end and saying, how are we going to measure the impact of this? And we got to start early. And I think what I think is really powerful is you're helping them think through what they're going to say in the grant proposal, probably to get better chance of funding. And then when it's done, they can better report how they did, which creates a great cycle of more likely to get more funding in the future because they have proof that it works and their program is successful. and they're measuring the right things and getting more funders and donors to support it because, hey, this is working and we have results to show. And now we just need additional funds or support to get behind this or redirect funds to this effort. So I think it is such an important part, and I don't know if they all realize the value that it provides, not only in getting the funds initially, but obtaining additional funds in the future or solving the problem so the funds aren't needed in the future, which is ultimately the bigger goal. So those funds could be diverted to other problems and other disparities that are going on.
Correct. And there's actually, I made a note to myself to bring this up because I think it really points to the importance of that data is not only a reporting issue, but it can also present as an equity issue, right? The Robert Wood Johnson Foundation did a report and they actually found that I think it's 60% of organizations who serve communities of color actually report that their impact was underfunded because they didn't have an evaluation system in place. That speaks to the importance of having an evaluation system in place, right? And like you said, starting early, you have a grant coming up and you make sure that when you're submitting that grant application, you have a solid evaluation plan and you go through. And I think that also improves your likelihood of getting the funds, right? If you have a solid evaluation plan in place, the funder will be a bit more willing to give their funds and ensure that their funds is going to an organization that they feel is equipped to not only serve the community, but to ensure that their programs are working, right? Especially in this environment where funding is hard to get, more and more funders are wanting to see proof that your programs are working so that, as we said, when it comes time for renewal or to provide you with additional funding for other programs or other communities, they can trust that this is a team that I know will have an evaluation plan in place and they will not only determine if their programs are working, but based on the data, they will reorganize or reallocate as needed. And another thing when we're thinking about equity is that having data, it's really important to disaggregate data, right? So if we're trying to see who's not being reached versus who's being reached, you will want to break down that data by demographics as an example. So whether that's race or ethnicity, zip codes, insurance status, if that's something we're interested in. So it's important to also break down the data to see who's being reached, who's not being reached, so that we can also make decisions based on the data and what the data is saying when we break it down by different demographics. So that's also important as well, is that when we're looking at data, in order to truly close the gap, right, we need to ensure that we're disaggregating our data points as well.
Yeah, to first even measure the gap. And I think that was something that was really eye-opening to me during the pandemic, was doing a little more research and just seeing, and this happens in the work I do too, right? We see a problem, we try to measure how bad it is, and then you're looking for the variation in outcomes and where do you have success in that whole process and where is it a struggle. And when you see it broken down by gender or race, and that's the outcomes are not the same depending on where you live and all these other demographic information, that shouldn't really be the case. Those should not be factors on whether someone gets treated successfully with a healthcare condition, that have access to food, to have access to healthcare. That should not matter. And yet it does quite a bit. And so solving those problems, you say, why is it working well over here? And why is it not working well over here? Why is there such a disparity? But in that difference is the key thing we have to do to change and say, how do we replicate what's going well? Or how do we fix the issues that are not going well? So that just able to disaggregate that data and separate it out into those groups and categories is an essential problem-solving skill. But you need that data and detail going into it so you can be able to study those patterns there. So yeah, I think that's all part of the training people get when they go through and start to think through this, so that you can find those opportunities inside of that overall problem. Is there's success stories in there, and there's really bad situations happening, and what can we learn from each of those that helps us come up with an improvement plan?
And I think especially because the the backbone of my career is focused on health equity, right? And that's given my personal experiences as well. But when we really think about, for instance, the social determinants of health, right? Even something as simple as incorporating those data points into your program, right? So we can look at things like whether or not someone's able to afford groceries, so food insecurity as a measure. And in the case of the example that I've been using, patients with or community members with diabetes, you may see that there's a subset of patients or individuals who they don't have controlled A1C, and you're able to look at different factors within the social determinants of health. So food insecurity as an example. And if that patient is food insecure, then that may be something that you may need to address to eventually see an improvement in their controlled A1C, right? Are they able to actually afford healthy foods? Transportation, have they been missing appointments because they can't get to and from the doctor? So things like that is definitely where I believe someone like myself, for instance, who has a lot of experience in that area, I'm able to look at the different factors pertaining to even the social determinants of health. And if it's relevant to your outcome, say, hey, have you thought about including this data point? So it's not even just the outcomes, right? I tend to talk a lot about the impact measurement because that's like the final goal is to be able to quantify your impact, but it goes deeper. There's several other factors that you have to think about. We touched on demographics, in this case, social determinants of health, evidence-based instruments. That's another thing too, right? You may want to incorporate some of that as well. I think that also points again to the importance of collaborating with a data expert because we know the nuances and what we may want to include based on your mission. So yeah.
And what are some challenges that the data poses? Because that sounds great, right? We just need more information, more data, but that data has been used sometimes not for good purposes. And there's been cases where the outcomes are not always trying to help people, maybe. So there's some resistance, especially in marginalized communities, to data and who's collecting it. What's this information going to be used for? And how do you help people overcome that? Or what are some things that can be done to support that if people are trying to do that and they're running into these barriers for obvious reasons?
Yeah, I think at the end of the day, it's gaining the community's trust. And that obviously takes time. It takes building relationships with the right people within communities. As an example, within the healthcare sector, especially for communities of color, religious leaders tend to be very much trusted, right? So there's been a lot of work around faith-based programs. So integrating your programs with a religious leader or a faith-based organization so that you can garner trust, right? So that's one way, is identifying the leaders in the communities that individuals trust and just building a genuine relationship with community members. I think we forget how powerful relationship building can be. And as you're able, obviously it takes time, but as you're able to build relationships and build the trust of individuals in the community, and when they recognize that you're doing great work, again, going back to data, if you had a program implemented and maybe you didn't have the greatest response because people didn't want to get involved because they didn't trust you as maybe a new organization or whatever the reason may have been, if you're able to quantify your impact and disseminate those results and community members are able to see the impact that you've made, that also helps with building trust, right? Because if you're able to say, hey, we implemented this program and here's what the program involved. Maybe it was going to workshops, maybe it was having healthy nutrition courses, maybe a stipend for groceries or whatever that looked like. And you were able to say, 75% of individuals in our program within 90 days had controlled A1C, then someone in the community, they're going to see that and say, oh, I want to be involved in that if they have diabetes. So I think going back to data, that's a way to build trust as well. But it is definitely it's a real challenge when you're trying to serve marginalized communities, because like you said, it's not always, when we find these inequities, it's not always addressed in the right way. And over time, it builds distrust. But I definitely think just finding the right community members who they trust, building relationships, and then also using your data to show the impact that you've made and making sure that community members are aware, right? So also making sure that you're getting it into the right audience so that they can see that you're truly making a difference. I think that helps.
Okay, I think I want to wrap up here. Or is there anything else you wanted to cover?
No, I think that's it.
So I'll just ask you to share how people can get a hold of you and website and social media and stuff like that. And then I don't know if there's anything else you want to promote. You got coming up, any programs, or you got the presentation coming up, but that's probably not for only local people. But yeah, so anything else you want to share or promote?
I do have a starter kit actually that I developed for
that'd be great.
I can send you that link too, if you want to include it.
Yep.
It's just like
I'll
an
put that in the
Excel
notes.
file. Yeah.
Okay. Let me kick it over to you and you can talk about that and how to get a hold of you. Okay, that's a really great discussion. I want to thank you again for joining. So how can someone get a hold of you, learn more about the impact measurement and how they can help improve their program and get the better success, capture some of these successes they're having, or understand what's working and not working in their programs? So how can people reach you?
Yeah, first of all, thank you so much, Brian. I really enjoyed the conversation and being able to talk with someone who's a fellow statistics fan. We're far and in between. So I really enjoyed discussing everything with you today. But yeah, so I can be reached via Map Data Studio's website. So that's mapdatastudio.com. And I will send all of this over to you, Brian, so that you can include it. And then you can follow us on Instagram as well at Map Data Studio. You can also follow my personal page, which is at also Dr. Shenae Samuels. I'm also on LinkedIn as Shenae Samuels Staple, PhD, MPH. And then you can shoot us an email if you'd like at info@mapdatastudio.com. And also, I do have a free starter kit that I will share that link with Brian as well. And it's a free Excel tool. No email is required to download it. And it includes an output audit. So you put a list of your current metrics, and it will actually help you to identify which of your metrics are outputs versus outcomes. Remember, we talked about the importance of having outcomes as well. And it is the goal of the free starter kit is to give you an overview of your current metrics, whether or not they're funder ready, and where you may need to put a bit more work in to get it funder ready, of course. And then obviously, once you've taken the starter kit, you can book a discovery call via the website mapdatastudio.com if you feel like you want to dive deeper and see if we would be a good fit to work together.
Okay, great. Thanks for sharing your story and giving everyone a good insight into this topic. I think it's really important. So yeah, it's something we touch on a little bit, but not to this kind of level. Hopefully everyone sees the value of this kind of work. So again, thank you so much for your time, and everyone reach out and learn a little bit more on how they can improve their organization and performance with the data they have, or start collecting better data.
Yes, thank you so much for having me. I enjoyed the conversation. Thank you.
If you like this topic, please check out the Lean Six Sigma for Good book series with the subtitle Lessons from La Gemba. We now have both Volume 1 and Volume 2 in paperback, ebook, and audiobook. Each volume has 8 chapters written by different Lean Six Sigma practitioners who have applied their skills to nonprofits, NGOs, not-for-profit organizations, and government agencies. Proceeds from the book sales are split evenly and go to the nonprofit selected by each author. Go to lean6sigmaforgood.com or search Amazon for Lean Six Sigma for Good. These books make a great gift for your process improvement team or someone you know who works at a not-for-profit organization.